What new imaging helps differentiate dementia types? Imagine being able to see tiny changes in the brain that tell us exactly what kind of dementia someone might have. Thanks to recent advances in brain imaging, doctors now have more powerful tools to tell different types of dementia apart. These new methods can detect subtle brain changes early, even before symptoms become obvious. One of the most exciting developments is advanced magnetic resonance imaging, or MRI. Traditional MRI shows us the size and shape of brain structures, but new techniques measure how water molecules move within the brain tissue. This diffusion imaging can reveal microstructural damage in the brain's gray matter long before the brain starts to shrink visibly. For example, it can help identify early signs of frontotemporal dementia, especially in people with genetic mutations linked to this condition, even before they notice any symptoms. Ultra-high field MRI, which uses a stronger magnetic field, provides sharper images and helps visualize tiny differences in brain structure. Special MRI sequences like diffusion tensor imaging look at the integrity of white matter, the brain's communication highways, while magnetic resonance spectroscopy can analyze the brain's chemical makeup. Combining these approaches allows clinicians to see a more complete picture of what's happening in the brain and distinguish between different dementia types more accurately. Positron emission tomography, or PET scans, are another breakthrough. These scans use radioactive tracers to detect specific proteins that build up in the brain. For Alzheimer's disease, amyloid PET scans can identify amyloid plaques, which are a hallmark of the disease, even in people who don't yet show symptoms. Tau PET scans detect tau protein tangles, another key feature of Alzheimer's. Because these proteins are different in other dementias, PET scans help doctors tell Alzheimer's apart from conditions like vascular dementia or dementia with Lewy bodies. These imaging techniques are now recommended selectively when the results will influence treatment choices or diagnosis confirmation. Scientists are also combining different imaging methods with machine learning algorithms. By analyzing complex patterns in multiple scans, these tools can improve early detection and classification of dementia. For example, they can help differentiate Alzheimer's from other types by recognizing specific neuroanatomical patterns. This multimodal approach is making diagnosis more precise and personalized. These imaging advances are not just for diagnosis. They help track how the disease progresses, predict who might develop dementia from mild cognitive impairment, and distinguish Alzheimer's from other conditions. They also support research into new treatments by identifying the brain changes associated with each type of dementia. Overall, these new imaging tools are transforming how we understand, detect, and differentiate dementia, leading to earlier, more accurate diagnoses and better tailored care. Always remember, these technologies are part of a comprehensive clinical assessment, and consulting healthcare professionals is essential for personalized diagnosis and treatment.